Mike Boni is a longtime OSTA member, expert in musculoskeletal conditions, to share his knowledge and provide insights into his course, Untangling the Neck. Hello, and welcome to Athletic Therapy Ontario's Health in Motion podcast. My name is Dawn Duncan, and I am pleased to be your host. Healthcare professionals, such as Ontario athletic therapists, spend considerable time working with patients who suffer from one or more of the three V's: vestibular, vascular, or vagal dysfunction. All three conditions can present with a patient complaining of dizziness, extreme headaches, and something referred to as brain fog. Could you please explain the term cervicogenic?
Yes, thank you, Don, for having me. Appreciate the opportunity to share some insight with the membership. So cervicogenics very simply means origin from the neck. And so there are many symptoms that can sort of relate to the neck or originate from the neck, but then can refer elsewhere into both the neck and upper head and facial region as well.
Thanks, Mike. As all our podcast listeners know, athletic therapists treat many patients for neck pain, but I think you untangling the causes and treatments for the variety of conditions that contribute to neck-related headaches and dizziness will be very valuable. I know from treating concussions that the trinity of cervical, vestibular, oculomotor interactions plays a big role in helping patients deal with headaches and dizziness presentations. But what you were presenting in terms of advanced clinical reasoning to help the treating AT make important clinical observations and treatment decisions seems to be on another level of competency in cervical spine care. Why do you think there is such a focus now on neck pain, neck injuries, and a range of neck ailments?
So that's a great question. I'm not sure exactly why there seems to be such a focus. I think part of it just seems to be awareness. In my clinical experience, I've been in practice for almost 30 years now. And previously, I noticed that more of the injuries that I treated in my earlier days were lower back related cases, lower extremity related cases. Of course, I did see neck and upper back and shoulder related cases as well then. I think, though, that today we're tending to see, first, there's two components that I think from my clinical experience. One, since the era of work from home, there's a lot more people that are sedentary and not as active. And of course, sitting at a desk or computer use, and that's changed, whether it's device use or computer use, that's changed the way people function on a day-to-day basis. So that I've seen in my clinical practice now an advancing of more neck, upper back, shoulder related pathologies that are often all integrated together. I would say in the sport world as well that we've probably become more aware of, from a sport perspective, of recognizing and managing concussion-related pathologies. And with that, there's been more of a consideration at looking at the cervical spine involvement with these types of injuries. In the earlier days, we didn't really think about the neck much. And certainly nowadays, we realize that this is more of a complex situation where it could not only be brain related, but also neck related, vestibular related. And it can be very challenging for the athletic therapist to navigate through these overlapping symptoms that present with these kinds of pathologies.
Mike, you mentioned MSK, musculoskeletal, and non-MSK conditions that contribute to neck pain and dizziness patient presentations. And you've discussed the need to help manual practitioners integrate current evidence and pathophysiological models related to cervical spine dysfunction. Is this why you and Paulo Sanzo co-founded the MSK Academy? How did your own practice become MSK and cervicogenic focus?
So thanks for that question again. Paulo, my colleague who is the co-founder of MSK Academy, who's also professor at Lakehead University in the kinesiology and medical sciences program there. Along with myself, we have been involved with the International Federation of Manual and Musculoskeletal Physical Therapists for over a decade. We noticed that high quality musculoskeletal training was limited in various regions around the world, whether it be underserved communities or where there's training limited. As a long-standing athletic therapist and physiotherapist here in Canada, I noticed long ago that advanced manual and musculoskeletal training was also limited to athletic therapists across Ontario as well as Canada. And while on the physio side, I had the opportunity to take plenty of course offerings. On the AT side, there wasn't as many course offerings. I did see that there was a need for it, teaching in the AT program that my AT colleagues weren't offering. So to help with that, in 2009, I started just a series of one-day workshops to help share some of that knowledge and experience exclusive to ATs in Canada. And those courses were welcomed and received very well. But after several years of being involved at the MSK community globally, Paulo and I decided to team up together to start offering these advanced MSK courses.
The association, particularly over the past couple of years as it has pursued statutory regulation for the Ontario AT profession, has spent considerable time developing evidence-informed clinical reasoning to support readiness for regulation. Your upcoming course, in fact, all of your courses offered at the MSK Academy, are focused on advanced clinical assessment training and advanced manual therapy skills. What would you say to ATs considering the Untangling the Neck course about what the primary benefit would be to them? And if I can add to this final question, what would the lessons learned at this course deliver to their clinical practices generally?
Great, thanks for that question. Also, another great question. I'd say that the certainly the AT taking this course can bring immediate hands-on advanced clinical assessment and treatment skills that can be used the very next day in practice. So what we teach is very practical based skills and a way of reasoning to sort of sift through some of the potential confusion that may exist within, these overlapping symptoms with respect to the neck region as well. I think more importantly, though, our hope is that the AT can feel more confident with developing these advanced clinical reasoning skills to differentiate the source of an athlete's complaints, neck-related complaints, or what seems to be neck-related complaints, whether it be related to head injury or whiplash-related injury, or just your typical sedentary postural type of activities that start to create neck problems. There's confusion sometimes as to is this serious pathology or not? And so differentiating that and ruling out serious pathology. Is this, for example, the person who sustained a concussion? Is the brain involved only? Is the brain and neck involved? Is the brain and vestibular system and neck involved? Or is it primarily driven by one of these regions, which, if you can identify that more confidently, then maybe we might be able to integrate more skills that so that the AT can help that in the end help the athlete or that client out more so. So I think that's probably the primary benefit, of course, with that evidence-informed lens and evidence-informed versus evidence-based, because I'm a believer that we need to respect what the empirical data suggests, but also we need to respect our own clinical experience and that of the client's experience or the athlete's experience as well. And that's what's going to help you develop more advanced assessment and treatment-related skills as well. Lastly, I'd add that the participant would be learning from two instructors, not one per se. That's often the case in a course. And we both have a combined experience of over 50 years of teaching as well as clinical expertise.
Excellent. Thank you, Mike. I am certainly intrigued by this course, and it seems we would all benefit from it. So, in closing, I'm going to give you the last word, and perhaps you can remind anyone listening how to register for your course, what the dates are, and where it is.
Thank you for that. I appreciate it. So, the course is called Untangling the Neck, and we just basically came up with that term just to get some clarity on clinical reasoning for the participant. The course is being offered at York University in August 20th from 8:30 to 4:30, and then the 21st from 8:30 to 12:30 the second day. There'll be some online asynchronous content that's shared through a Google Classroom. There is still some limited space. It is filling up. We're going to keep it lower numbers per se.
Excellent. Thank you so much, Mike. And for those who couldn't take all that information down quickly, the course link is also on the OSTA website. So thanks again so much for joining us on Health in Motion today, Mike. It was a pleasure talking with you.
Thank you, Don. Appreciate the opportunity to share our vision, and hopefully it could help service the need of Ontario athletic therapists in the wider community as well.